I bought a radio to try to help to explain what the different things on the stimulation machines are compared to something that we're all used to using in everyday life. You'll see in your instruction booklets that it talks about frequencies and pulse widths and intensities and amps. But actually, it's not as different as you would think to what you know from a radio. So when we have a universal on button. So first thing we do, we turn ourselves on.
That's the Kegel8 on.
And that's the radio on. But you can't feel anything. And my radio is making a tiny bit of noise, hardly anything at all. So we're both on, but nothing's really happening. The second thing we do is we choose our radio program on the radio, and you're going to choose your treatment program.
Choose the program for me.
For you.
Yeah.
Now, in the past, you used to have to know the frequency of the radio program. And you do sometimes see it on adverts or on buses when there's a new radio station. They tell you what the frequency is that you must tune into. But nowadays, most things are pre-programmed, so you can just go straight to the name of the radio program from a list or from preset buttons. And that's exactly what the stimulation machines do. They've put them into preset programs so you don't have to know the detail anymore.
It's all pre-programmed.
So you choose, do I want to do neuromodulation, which is usually called an overactive bladder or an urgency program, or do I want to do muscle strengthening, which is usually labelled as a stress incontinence program, even if you haven't actually got stress incontinence, but you want to get your muscles to exercise. So you just need to know which program you're after. I need to know which program we're after, and we choose our program. So choose your program, and I'll choose my program. Yeah. And now we still can't hear anything. Nothing's happening. So I'm going to turn the volume up on the radio until I can just hear something. You're going to turn the intensity up or the amplitude until you can feel something.
And obviously the probe is already inserted, so we've already got that connection. And then that's
your up and
like
down button.
A volume button.
It is. Yeah. And you're going to use the volume buttons on the same side that you've plugged the electrode, either the electrodes, the surface ones, or the internal probe in. If you've got two things running, an internal probe and some electrodes, or two sets of electrodes, then you're going to have to do this on both sides. It's like you've got two radios.
Yes.
And they're going to be independent volumes.
And then the plus button is what my muscles will hear.
Yes.
Almost like the radio is what we hear.
Exactly. And then some days you want your radio up really loud. Imagine you're in the car, and some days you want it blaring. It feels good to have it loud and you like it. But other days that feels a bit grating and you would want to tone it down a bit. And that's the same with our muscles. Even to the time of day, you might find in the morning when they're fresh, it feels nice to have it quite high. But in the evening, when you're tired and your muscles are tired, they maybe won't tolerate such a high intensity and you need to keep it a bit lower. And that's okay.
So the MAs, the intensity is literally, it's the volume, and it's like a volume button. It's what your muscles hear.
Yes. And you don't need to blast them because that could actually hurt them and make you sore. But you do need them to hear something. And if it's too low, not that much will be happening. Except when you're doing neuromodulation, you don't need to turn it up so high that you feel a contraction. If you're getting a contraction, you can ease back a bit. It just needs to be sensory.
And neuromodulation is for
the one
overactive
for
bladders.
The overactive bladder or the urgency.
Yeah.
But if you're trying to exercise your muscles, you're trying to edge it up enough that you do get an actual contraction.
Great, thank you.
I hope that's helpful and not more confusing.
No, that's great.
We'll see how we go.